Good morning. Do you think that Indonesians are better informed than Malaysians in the matter of health? Every year, thousands and thousands of Indonesians come to Malaysia to seek medical treatment. Even though there are a lot of hospitals in Indonesia that offer similar kind of treatment options available. But they know what's good, and they don't mind traveling long distances at great expense to them to seek better medical care and treatment. Do you know that of all the medical tourists that come to Malaysia, 61% of them come to Penang because traditionally, culturally, we are closely linked to our Indonesian neighbors, especially from Medan, but nowadays even as far as Jakarta, Surabaya, even Pontianak. So there's a reason why people choose to come to Penang. And of all the medical tourists that come to seek treatment in Penang, there's one hospital that attracts the most of them. That is Island Hospital, where I'm currently based. Island Hospital attracts more than 50% of the overall medical tourists that come to Penang to seek treatment. And the obvious reason would be that people trust us and they like the way we treat them. So there is a reason behind it. But local people, most of them, perhaps for conventional reasons or for whatever reason, seek out other hospitals in preference, perhaps. Now, this morning I had an amazing experience with one of the patients who requests to see me as a resident surgeon as opposed to a visiting one. Now, do you know the difference between a visiting surgeon and a resident surgeon? By definition, a resident surgeon is resident within the hospital and is available 24/7 to come to any emergency treatment if necessary, whereas a visiting surgeon is based elsewhere and may be doing major surgery elsewhere and would not be immediately available should any emergency situation arise. So, Indonesian patients know the difference between visiting and resident surgeons. Do Malaysian patients know that? Perhaps some of them do, but most of them, for whatever reason, choose not to exercise any freedom in regard to this situation, and they would just follow what the doctor advises. And some of these have prearranged situations where it benefits perhaps many parties, not just for medical reasons. And I need not explain more on this basis. So the next time you choose to go to a hospital, perhaps you think a little bit more about why some hospitals are more popular and why people would prefer committed resident doctor than visiting mercenary kind of professional arrangement. What do you think?